Welcome back, my good people. And in today's video, we are going to talk about how to become pregnant faster 2025. And this is a very, very important guide for those people who want to conceive. Um, we are talking about natural and medical option for those who are battling with fertility, those who are trying to conceive, those who are trying for a baby. This is the best video for you. So this is your presenter, Dr. Pamli, and do like, share, comment, and subscribe to this particular channel. Now, let's jump into the video and do it. The bigger question is that why couples may want to live faster. And also we are going to look about overview of natural versus medical option. Now, why couples may want to conceive faster is very, very important. And we consider biological and health factors. Advancing maternal age, those who are above 35 years of age, particularly the female, it may be very, very difficult. That particular period, they may be facing fertility challenges or even medical conditions. So it's a factor to consider. Personal and emotional reasons. There's a strong desire for parenthood, reducing anxiety from delays or strengthening the relationship. And this is a particular place, a particular point that we should consider. Social and practical consideration, like career planning, you want to go back to school, sometimes you may not enjoy this one. Financial readiness, cultural and family expectation, like you've been married for some times and your in-law is giving you pressure or aligning childbirth with life goals. Uh, First of all, we may understand the fertility window. And in this particular option, we are going to talk about how to track the menstrual cycle, ovulation predictor kits is very, very important, and even basal body temperature and cervical mucus. Now, these are detailed steps for tracking your menstrual cycle. First thing you'll be able to do is to mark the first day of your period. That by recording day 1 menstrual bleeding, not spotting. This marks the beginning of a new cycle. Count each day until the next period starts to know the total cycle length, typically between 21 days, 35 days. And number 2, you should be able to identify the fertility window. Ovulation usually happens about 12 to 16 days before the next. So tracking this by calculating from your average cycle length. For example, in a 28-day cycle, ovulation often occurs on day 14. Now, track physical and hormonal signs. Notice cervical mucus changes. It becomes clear, stretchy, and slippery like egg white around ovulation. Monitor basal body temperature. It slightly rises after ovulation due to the progesterone level side. And watch for ovulation symptoms like mild pelvic pain, breast tenderness, or even increased libido. Use tracking tools and tests. Keep calendar or use period tracking apps to log cycle data consistently. Ovulation predictor kit can detect luteinizing hormone surge that signals ovulation within 12 to 36 hours. And review and adjust over time. Track cycle for at least 3 to 6 months. See patterns and identify fertile days accurately. If the cycles are regular, you should be able to be recording symptoms and even using OPKs that become more important. This information may help in planning conception or even discussing concern in the health with the healthcare provider. Now, we must put into consideration our healthy lifestyle choice. And this is very, very important in that one, we must maintain a healthy weight Both underweight and overweight can affect fertility. In fact, they interfere with the progesterone and estrogen levels. Eat balanced, fertility-friendly diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats. Exercise regularly but moderately. Avoid excessive or very intense workout. Manage stress effectively through relaxation, do yoga, meditate, even involve yourself in counseling affecting you. Coffee, that is caffeine and alcohol intake. In fact, this one you should just avoid this. Both can interfere with your fatigue. So get enough good quality sleep, at least 7 to 8 hours per night. Balance reproductive. Always drink water. Water supports cervical mucus production, overall body function. You should be able to monitor and track the menstrual cycle to identify the fertile window accurately, the way we mentioned earlier. Quit smoking and avoid recreational drugs. They reduce sperm quality and even egg health for men. Schedule regular medical checkups to manage conditions like polycystic ovarian syndrome, thyroid issues, sexually transmitted infection that can affect fertility. Now, this is also a very, very important matter. Timing of intercourse. If you want once, but trying for a baby, best days are 2 to 5 days before ovulation as the day of frequency. You must do it as every 2 to 3 days during your fertile window. It's very, very important because we have the scientific evidence. Says maximize the chances of fertilization. The intercourse during the fertile window is about 5 days before ovulation, and the day of ovulation aligns sperm presence with egg release, increasing pregnancy rates. The studies shows conception is most likely when sex occurs within 1 to 2 days of ovulation. Improves sperm survival. Sperm can live 3 to 5 days fertile cervical mucus. So, timing sex ensures sperms are waiting in the fallopian tubes. Ovulation occur. Optimize egg viability. The egg survives only 12 to 24 hours after ovulation. Correct timing ensures sperm meet the egg during this narrow window. Increases pregnancy success rates. Research from the New England Journals of Medicine have found that intercourse on the fertile days increase the probability of conception to 25 to 30% per cycle compared to the less than 5% outside the fertile window. Reduce time for to conception. Couples who track ovulation and time of intercourse conceive faster, often within 3 to 6 months, compared to those relying on chance. Enhance natural family planning. Learning fertility signals, cervical mucus, basal body temperature, luteinizing hormone test helps couple plan or avoid pregnancy without drugs or invasive. Now, improve sperm quality use. Frequent, well-timed intercourse ensures fresh sperm with better motility and morphology reach the egg as sperm quality declines with long. Support hormonal synchronization. Sexual activity around ovulation may enhance natural surge of luteinizing hormone, which triggers ovulation, further supporting the reduce anxiety and frustration. Structured timing gives couple a sense of control, reducing the emotional stress or trying randomly for a long period. It's helped to identify fertility issues early. If conception doesn't occur despite correct timing after 6 to 12 months, couples can seek medical help soon, avoiding unnecessary delays in fertility treatment. Supplement that we may help: folic acid, vitamin D, coenzymes, omega-3 fatty preconception supplement worldwide. Folic acid, crucial for DNA synthesis and cell division. Iron supports healthy blood volume and oxygen transport. Vitamin D, important for calcium, hemostasis, and immune regulation. And DHA and omega-3 supports brain and health and development of fetus. And if we may continue, Folic acid has 5 main importance, and it's very, very important that it prevents neural tube defect. Uh, Adequate folic acid reduces the risk of serious brain and spinal cord defects like spina bifida and anencephaly. Supports DNA synthesis and cell division, is essential for proper growth and development of the embryo, the earliest stages. Then promotes health egg, healthy egg development that improves egg quality and supports plantation, the uterus. Reduces the risk of pregnancy complication. This one may help lower the chances of miscarriage, preterm birth, and low birth weight, and even supports maternal health. This one prevents maternal anemia and supports overall blood tissue health during pregnancy. So the supplements normally we'll have prescribing Fertility F, even pregnacare conception, and there is also pregnacare conception marks. Very, very important for you to look for this. And I've made a video about all these two drugs. You can check my channel and even in the description below for the videos. So it's very, very important to consider those particular drugs. So drugs that now promotes fertility, that's fertility drug, and topmost is clomiphene citrate, coming in trade name of clomine and serophene. And the selective estrogen receptor modulator, and this one blocks estrogen feedback at hypothalamus, thereby increasing gonadotrophin releasing hormone, follicular stimulating hormone, and luteinizing hormone. And when this happens, ovulation is being induced, and also it's helping the ovulatory disorder like polycystic ovarian syndrome management. This is an example of the tablets provided to you here. And the usual dose of clomiphene is we start a dose of 50 milligrams orally once daily for 5 days, usually beginning on day 2 to 5 of the menstrual cycle. If ovulation does not occur, dose may be increased in subsequent cycle, 100 milligrams one daily for 5 days. Maximum recommendation dose is 150 milligrams per day for 5 days through, though this is rarely. During duration of the therapy, most guidelines suggest not using clomiphene for more than 6 cycles, as success rate drop and risk, e.g. ovarian cyst, multiple pregnancy, endometrial thinning increases. Now, it's very, very important to note that clomiphene should be prescribed and monitored by a doctor, your health worker, ideally with ultrasound monitoring to reduce the risk of ovarian hyperstimulation syndrome, multiple birth defect. Letrozole is another one, the trade name of Femara, the aromatase inhibitor. It lowers estrogen production. Low estrogen removes negative feedback, therefore increasing follicular stimulating hormone. When follicles are stimulated, they now develop. Now, use preferred in polycystic ovarian syndrome, high live birth rate. Very, very important to use letrozole, and Novartis is providing this as Femara. Now, kindly note that it's also very, very important to know the dose of letrozole. The initial dose is 2.5 milligrams orally daily for 5 consecutive days, starting on day 2, 3, 4, 5 of the menstrual cycle. If ovulation does not occur, dose may be increased in subsequent cycle to 5 milligrams per day, 5 days, and if needed, up to 7.5 milligrams daily for 5 days. Maximum dose 7.5 milligrams per day for 5 days per cycle. Duration of therapy usually tried for 6 cycles, similar to clomiphene. Note, letrozole is now often preferred over clomiphene in women with polycystic ovarian syndrome. A study shows higher live birth rates and lower multiple pregnancy risk. Gonadotrophins like follicular stimulating hormone, luteinizing hormone, human chorionic gonadotrophin. These are also very important to note, and also metformin, which is an insulin sensitizer, reduces insulin resistance. It also restores hormonal balance in people with polycystic ovarian syndrome. and it restores ovulation and may be combined with clomiphene and letrozole. You know, this drug is also used in diabetics, so we may monitor blood sugars. So progesterone luteal supports endometrial early pregnancy, and they come in vaginal, even oral or injection. And then it's used for IVF support and recurrent miscarriage. And bromocriptine and cabergoline, these are dopamine agonists, lower prolactin levels. Conditions like prolactinoma, we may prescribe them. High prolactin levels suppresses atrophin releasing hormone and ovulation. Hyperprolactinemia related infertility, particularly brought by prolactinoma, a tumor. Now, DHEA, dehydroepiandrosterone, it's a very tough name there. As androgen precursor, may improve ovarian reserve, enhance follicle response in poor ovarian function. Before IVF is admissions, very, very important. Use assisted reproductive techniques that we may use to help our women: uterine insemination, IVF, in vitro fertilization, and intracytoplasmic sperm injection. These are now preferred. Gynecologists may advise when fertility doctor further. Now, when do you want to see a doctor? If you are trying for a baby and there is nothing coming out, like if you are less than 35 years and have tried for 12 months with no success, or you are greater than 35 years, you've tried for 6 months, you have a regular or absent periods, possible anovulation, or you've known history of pelvic infection, that is PID, endometriosis, fibroids, pelvic surgery, even ovarian cyst, you'll be able to see your doctor. Even if your male partner has erectile or ejaculation issues or non-testicular problem, or you have had greater than 2 miscarriages. Remember, we are just concerned here with female. We'll make a video again for male. Now, emotional or mental support. This is very, very important. Counseling therapy, individual couples, speaking to a psychologist or a fertility counselor. Very, very important. Support group of the community. Very, very important, because this one helps in sharing your experiences with people to get it, encourage and practical coping with the tips. So it's very, very important. Stress management and relaxation techniques are highlighted here. Get do yoga. This one may help in hormonal balance. Healthy relationship and dynamics, very, very important. You'll be able to have honest, open communication with your partner and maybe have fun. Healthy relationship dynamics, also very, very important to consider in this scenario. Self-compassion and balanced outlook, reframing fertility as a medical condition, personal failure, setting realistic expectation while staying hopeful, and exploring alternative paths like what we've been talking about, IVF, an option if needed. So advanced methods are also there. AI is taking part, creation of apps, genetic testing for embryo selection, improved IVF success rates have also been recorded. So parking lot. Dear couple, remember that your journey, parenthood, is unique, precious. Though weight may sometimes feel heavy, each steps bring you closer to the dream you hold in your heart. Be gentle with yourself, nurture your love, and know that patience, care, and hope are very powerful companions in this path. The desire you carry is a testament to the deep love you already share. And in time, the love can blossom in family you long for. So guys, like, comment, share, and subscribe. This video is very, very important if you share, because it's for people who are trying to conceive, those who are battling with fertility. See you in the next video. Muchas gracias.